सिस्टर के बाहर करने
निकाल
ड्रिल बोर्ड से
this what is that? फाइल देखिए रे चल the life then it's age 56 चल life चल 56 years lady complaints of severe left more than the right radicular pain for last 7 years, intermittent walking distance is almost homebound, not able to stand beyond 5 to 6 minutes, walking distance almost homebound for last 7 years, severe lumbar canal stenosis for sea level. So we plan to start with the L4-L5. The L4-L5 is the mostly affected, and this is the L4-L5. This is the spinous process, superior lamina, inferior lamina facet. So cranial, L4 lamina, caudal, L5 lamina facet, and the spinous process of midline. So now we have detached the ligamentum flavum cranially. Now we are going caudally to detach our ligamentum flavum. The superficial layer is already removed, partially left here, caudally. Now this is the detachment of the flavum from the inferior lamina. Now this is the flavum, the deep layer of the flavum. Like this. Pretty.
वो टिल्ट मोड को
Like pretty.
डबल टेल किधर
ଆମେ ଯେଟା ସବସ୍କ୍ରାଇବ୍ କରୁଥିଲେ ଏଠି କାଟିଲା ବେଳେ ଏଇଟା this is not the dora. Dora is here. Yeah. 45. Now she is only 56 years, but there is a lot of osteoporotic bone. She is scoliotic and suffering for last 7 to 8 years. She has the bilateral knee arthritis, also varus deformity, needs the treatment for the bilateral knee also. But presently she had the more complaint of the radicular pain, claudication, and not able to stand, walk. So the spine has to be take care first. this is the midline. We are just trying to decompress and remove the overhanging portions of the midline structures. Gradually, we are trying to go to the opposite side. So this is my caudal petty, 45. So this is the foraminal area, and we are at the foramen of the opposite side. We are approaching from the left side. Now we are at the right side foramen. Dispersor. Now just repositioning our petty. This is a cranial petty. Reposition at the right side. The bone of the opposite side come. Now this is the facet. Overhanging facet. Lateral canal stenosis is very, very severe. Dispersor. Spatula. We are trying to see the nerve root here. Dispersor. Choto petty. Choto petty. Very, very tight canal, so I like to put a smaller petty and see the two mm. Now instead of 3 mm, now I am using 2 mm, and this is on the nerve root here. This is the opposite side, right side nerve root, and we are at the nerve root. So this is my nerve, and this is the shoulder of the nerve root, which is visible now. this is coming in my way at a trajectory. So just sacrificing a bit of the 1 millimeter of the bone so that I can see better and decompress the nerve root of the opposite side. Disc. Okay, 45. Photo. Nerve root is very clear up to the foramen. Look, 45. Yes, this is the SAP, the hypertrophic portions of the medial aspect of the SAP of the opposite side. Yes, now the very much clear and free, mobile. Photo. This photo. Table tilt ಮಾಡ್ಗು ಆರ್ಬಿಟ್ ಡೌನ್ ಆಯ್ತು ಕಟ್ಟಿ ತಾವು This is the SAP of the left side. We will come back to the left side. Now we are at the foramen. So we are decompressing or tracing the nerve root up to the foramen now. Spatula. And this is the medial aspect of the SAP. This is on the nerve root, hypertrophic portions that has to be removed so that complete nerve will be decompressed. Now the shoulder of the nerve root is very clear. Up to the foramen we are tracing the nerve. Like the spatula. So now let's see, is there any disc? Looks like a disc. The
ପଟ୍ରି କୋଡ଼ିଏ କର
spatula a disc there. छोटा पेटी.
ଠିକ୍ ଅଛି
Disc for sale. Spatula. Okay. उल्टा नहीं लो देखिएगा
ଆସିଲେ କି
disc for sale. ଆସିଲେ
ରେଡ଼ି ନା
So 56 years lady, we have done the 4-5 here and now 3-4 from the same port. The severe lumbar canal stenosis, 3 level, 3, 4, 4, 5, 5-S1. Now 4-5 was the most severely affected, so that we have done first. And it is a left approach, patient complained with the left side. She is having the osteoporotic and also scoliosis, homebound for years together, almost 7 years, severe claudication, and we are decompressed. We have decompressed the one level now, that is the L4-L5, and this is the L3-L4 level. So this is the L3 lamina, L4 lamina, facet, spinous process, midline. Okay. Now we are at the left approach. So cranially the flavum is detached at the spinal laminar junction. Now gradually we are coming laterally. This is the hypertrophic facet. Hypertrophic facet, the medial aspect. And this is my superficial layer of the flavum. So deep layer also now detached from the inferior lamina. So the deep layer of the flavum is coming along with my small bone chips, that is from the inferior lamina. This is the medial aspect of the facet. केजी एगला टिके तभी एक पड़ोस नहीं राइट कर झाड़ी दे पानी है. Now we have detached the flavum of the left side, cranial and caudally. Laterally also medial aspect of the facet we have removed a bit. Now spatula. Yes, now let's see. Hmm. 45. टेबल डील कर दे अपोजिट को.
और कुछ
Now we are trying to hit the midline. हाँ हाँ हाँ. So this is the midline now. Left 45. So beauty of this instrument is called the destined to endospine system. Is a mobile operating system. It can be mobilized with the left hand, with the right hand in coordinated way, left, right, cranial, caudal, midline, lateral, everywhere. So that's why very easy to handle the two-level stenosis, severe stenosis, bilateral decompression over the top from the single port 25 millimeter around incision, 20 to 25 millimeter incision will be enough to decompress, and we are using the best vision system, that is Endovision of Storz company. That is the Endovision of the Storz company.
लाइट ऑन करो लाइट ऑन
3D 4K Endovision system. Okay. तले पड़ला पर शब्द हला या पर गोटे बरला कोन ठकिना शब्द हला
तले रूम लाइट ऑन करना
रूम लाइट ऑन कर
ଗୋଟେ ଛୋଟ ସ୍କ୍ରୁ
now off, headlight off. Now gradually we are going to the opposite direction, that is the right side over the top. So the same incision we have done the L4-L5 and this is the L3-L4 from the single port. Recently in 10-15 days back we have done 2 cases of the same thing, severe lumbar canal stenosis, 2-level decompression from the single port. I think this is the 3rd case in 15 days that we have done the 2-level bilateral over the top decompression from the single port. No need to take the separate port, only one port is enough. Now disc cursor. So we have crossed the midline, we are going towards the right side. Now 30. So gradually we now focusing towards the nerve root of the opposite side, that is right side nerve root. Yes. So very very tight canal, 2 mm. 3 mm will be difficult to enter here. Now this is the opposite side. Very tight canal. And this is the cranial end. Well, the shoulder of the nerve root is visible now. So we could negotiate the instrument at the shoulder to remove the hypertrophic portions of the facet and also the flavum attached to it. So now you can see the nerve root. This is my shoulder of the nerve root, and this is the opposite side SAP, supraarticular process. There. So I just removed that hypertrophic portions of the supraarticular process. This is the second bite of the bone. See this? So hypertrophic portions of SAP is removed. Of the opposite side. Now this is my foramen. You can see the nerve root stressing. I am towards the foramen. EMM. Okay. Spatula. Photo. So the opposite side nerve root completely decompressed up to the foramen, and this is my foramen. This is the shoulder of the nerve root. This is the cranial end, caudal end, and the foramen. Okay. Now don't wash the it there later. Was gel foam. आप जल रहे टेबल टिल्ट करो मार्ग हटे हटिए हटिए तब हटिए दे जल फोम भाई चल चल कैमरा पूछ झाड़ी दे पानी अच्छा है So over the top we have done the decompressions of the right side. Now we have come back to the left side. Then we are approaching from the left side. Now left side foramen anatomy, decompression. Then we will go to L5-S1. So both the level 3, 4, 4, 5 we have done completely. Bilateral over the top decompression from the single port. The disc. Disc. Spatula. So this is my caudal end of 3, 4. This is the 4, 5 here. It tissue does 45. अच्छा देख पेटी अभी 45 So lateral border of the nerve root is visible now. No need to remove more bone here. The trimming, decompression, the nerve root up to the foramen. So this is my foramen and this is my nerve root here. Now spatula camera the है जी झाड़ू नो कैमरा ठीक ये ठीक से काट कैमरा कुछ देख the foramen, the nerve root is coming here and it is going out here. So this is the extraforaminal area. You have to dissect a bit here. This is the intertransverse ligament. Then you will get the exciting nerve root of lower level. That means L4 level. This is the L3-L4. So this is the L3-L4 nerve area. This space, this nerve is the L4 nerve. The L4 is coming out here, which will be the exciting for the L4-L5. Okay, very nice. Two-level bilateral decompressions over the top, the disc percept. It is here pretty. ऊपर है अच्छा देखिए this percept there spatula this percept there काट दें काट दें दे ने फोटो वीडियो ने
टॉप लाइट ऑफ कर रहे
चल जी এইটা এইটা নে এইটা এইটা সহ সেটা না দিটা একাথরে দেখা তো আর ধরে নেলে ওটা হেজি হয়ে গেল এটা জল 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 দেখা গেল କେତେବେଳେ ଏରିଆ ଠିକ୍ ଦେଖାଉଛି କେତେବେଳେ ଚେଞ୍ଜ କରିଦେଉଛି ଜାଲ ଜାଲ ହେଇଯାଉଛି ତ ଠିକ୍ ସେ ଫୋକସ୍ କର ଏଇଟା ଏଇଟା ଦୁଇଟା ଟାଇମ୍ ଦେଖାଉଛି ଦେଖାଉଛି ଏଇଟା ଏଇଟା ଆଉ ଟିକେ ଆଲୁଅ ଦେ ଟିକେ ଆଲୁଅ ଦେ ହେଇଛି ଆରଟା ବନ୍ଦ କରିଦେ ଏବେ ଠିକ୍ ଅଛି ଏଇଟା ଦେଖାଉଛି ଟିକେ ଉପରକୁ ହାତ କଲେ ଏଇଟା ଦେଖାଯିବ ଯେ ଗୋଟେ ପୋର୍ଟ ଅଛି ଆଉ ସିଙ୍ଗଲ ପୋର୍ଟ ନାହିଁ ବୋଲି ଏବେ ସେ ଅନୁସାରେ ଫୋକସ୍ କର କ୍ୟାମେରା ଦେଖ ହେଲା ଏବେ ଦୁଇଟା ଦେଖା ତଳ ଉପରେ ଦେଖା ଆଉ ଟିକେ ତଳକୁ ହାତ କର ଆଉ ତଳକୁ ଏଟାକୁ ଏଟାକୁ ଦେଖେଇଛି ଦୁଇଟା ଦେଖାଉଛି ଏଟା ଆଉ ଏଟା तो ठीक से फोकस कर, এটা হলো nerve root. So this is the bony bridge intact, and this is 3-4. We have done the nerve root decompression. This is my nerve. This is the cranial, and this is the opposite side. Opposite side we have done very nicely decompression of the nerve root of the foramen, and this is the L4-L5 level. This is the nerve root of the L5 here. This is the nerve root, and this is the opposite side. That means the right side. This is my gel foam I have given for my hemostasis. This is the nerve root of the opposite side. Okay. So this is the L4-L5. This is the L5 nerve root of the right side. L5 nerve root of the left side. This is the L3-L4 level, keeping the bony brush intact from the single port. You can see my hand movement and outside picture. This is the port. This is the nerve root of the L3-L4. That means this is the opposite side L4 nerve root. So bilateral over the top decompression from the single port, very nicely due to the mobility and beauty of this instrument. Just time to set. Thank you. चल हेगला दे स्वागत दे वास फोटो भी नहीं जाती इनसे नहीं जी फोटो ये नॉर गुड़ा देखो तुली फोटो नहीं लूँ जेता ना दे ना खाली वीडियो नहीं लूँ आउटर नहीं जा दे दे तो चलो दे आउटर फोटो नहीं जा ये वाली ब्लेडर था ऐसे ब्लेड का कैमरा कुछ देरी कला मैंने से ब्लीडिंग आसी या को टच कला ये टाणी जी जाची एक बंद कर पहले नहीं कर नहीं दे दे देखते चला नहीं फोटो नहीं L3-L4 L4 nerve root. This is the foramen, and this is the L3-L4 opposite side, the right side foramen, L4 nerve root, and this is the L4-L5 level. This is the L5 nerve root, foramen, and this is the L5 nerve root of the right side. This is the left side, this is the right side. Over the top decompression. Chal. I don't know. There. Over there. Hey ji. Hey ji. जी नहीं चल कर करने वाश कर वाश वाश दे जल फोन दे तो आ गोटे लेवल रहा ब्लीडिंग छाड़ सक्शन छाड़ बंद कर दावटी पट्टी दे ये जो जल फोन दे जल फोन दे पट्टी दे जल फोन दे पेटी दे मैं आवड़े जल फोन दे आवड़े जल फोन दे आवड़े पेटी दे चलो